For health professionals, knowing how to perform under pressure can literally be a matter of life or death. My name's Alex. I'm a trauma and orthopedic surgeon by training. I also founded and sold a medical education company when I was a medical student and scaled another one internationally as a resident. I founded Virti as there's no way to recreate the stress or emotion of real clinical practice and no way to scale work-based training. At Virti, our mission is to make experiential learning and education affordable and accessible for everybody on the planet, starting with healthcare, in order to improve human performance. Now, as a doctor myself, I can tell you that the first time my skills were truly tested under pressure was the first time that I encountered an acutely unwell patient. Well, that's a massive patient safety concern and one of the biggest causes of death in Western healthcare. There are upwards of 250,000 deaths each year in the US alone due to medical error, costing health providers $20 billion in payouts every year. To mitigate against this cost, providers spend $2.7 billion on mandatory in-house, in-person training for their workforce, with no way to reduce those costs or scale them outside their four walls. In developing countries, such as the 47 in sub-Saharan Africa, 11 don't have any access to medical training at all. What we're trying to solve is a problem of scale. At Virti, we tackle this enormous problem by integrating with medical curriculums and mapping to the needs of the learner, right from the very first time they step foot into a medical institution with no knowledge, through to when they finish their training as a consultant medic. We utilize real-world 360 video to transport our users into difficult-to-access clinical environments and safely assess them under pressure. We then move them onto our AI-powered virtual patients, where we use natural language processing to assess everything from empathy to their cadence and contents of their speech to see how they will perform when they're presented with real-life clinical patients, which is incredibly important when most complaints in hospitals are 70% attributed to poor communication from medical staff. Finally, and most importantly, everything our users do under pressure in these environments is pulled into our cloud-based data analytics dashboard so that both the users and the educators can find new objective ways to improve their workforce. As a model, we provide a cloud-based web system that allows our users to create their own content at their own convenience, affordably, using 360 video or our AI-powered virtual human scripting system. This is then distributed both to affordable VR headsets and also to mobile devices, making it a truly scalable and affordable platform for everyone at any time. Finally, all of that content that's created by our customers is then able to be licensed to other people in our network, deriving new revenue streams from everybody in our network. Importantly, everything our system does has been shown to be effective for every single one of our customers. Averaged across our entire network, we can show upwards of 75% improvement in actual clinical performance, leading to reduction in training times of upwards of 40% and cost savings of 33% on the average spend per institution. We've also published 5 major research articles showing everything from improvement in confidence and performance to reduction in anxiety and stress for workforce individuals. Behind this sci-fi tech, we've got a world-class team. We currently have 14 employees and are growing fast, with skills including PhDs in computer vision and VR humanities, and a BAFTA-nominated Unity developer, and our CTO, Nils, who's here today with us. Everything I've just told you, we've done over the last 2 years. We're pre-Series A, we're revenue generating, we've raised over $2 million in venture funding, and over $1 million in SBIR grants to scale our platform. We've patented one portion of our technology and have published 5 research papers, and we're the only education platform ever to be a part of the National Health Service's Scale and Innovation Program, which recommends evidence-based tech solutions to be sold into the National Health Service. And we've also won a couple of awards, including the VR Healthcare Award last year and the Mayor of London's International MedTech Startup Award. We've had a great time as part of RLab and on the East Coast, locking down deals even just in the last few weeks, and we're sticking around here into the new year. So if you are a customer, an investor, or an institution wanting to do research, we'd love to hear from you. Thank you.